Shortages in medical staff in handling the COVID-19 pandemic have led many European nations turn to their migrant communities for help. France saw Emirati doctors on scholarship programs refuse repatriation in favour to stay. Dr. Mohammed El-Falasi said he wanted to help his colleagues during this troubling period. When President Emmanuel Macron happened to ask the nationalities of a team at Marseille University Hospital, the moment went viral. But it's not just migrants who are putting their lives at risk to help others. Arab refugees are also volunteering. Mohammed was training to be a surgeon in Libya before the war forced him to seek asylum in France. When the COVID-19 crisis began, he immediately registered on the emergency roster and was sent to French Guyana.
I try to protect myself as much as possible. But if it's COVID, then it's written in my fate. I cannot change it. But at the very least, I try to save some people's lives. Those who need me the most. Their life may be more beneficial to the world.
While across the channel in Southampton, Dr. Hamid Hawana believes his experiences in Syria have helped him prepare for the UK's outbreak.
The support that I get here in the UK actually always pushed me to do something and give something back to the community. And that's why I always feel proud that I am doing something and helpful, and I am helping people who need support.
Across Europe, the process of converting a medical license is long, bureaucratic and expensive. It took Hamid 4 years to obtain the qualifications needed to work as a doctor in the UK, and Mohammed is still waiting to receive his license from the French authorities. Anna Jones of RefuAid, which helps refugee medical professionals back into employment, believes more needs to be done.
So COVID-19 has meant that the medical requalification exams, the PLAB 2 for the remainder of the year, have been cancelled, meaning hundreds of doctors are unable to qualify and return to work. So what we're lobbying for as an alternative is people to be given the opportunity to work as a medical support worker and be assessed on the job after 6 months of work as a clinical assessment as opposed to an exam.
Relocating from Baghdad to Wales aged 3, Dr. Hashim El-Meshahadani knows all too well the benefit refugees bring to a community.
There's a certain work ethic that comes from people who've gone through hardship because they know how, they're not shy of working hard and making their way. And given the opportunity, they will take it. And I think we'd be silly not to take on people like that and make it easy for them to be able to come.
With refugees and migrants working hand in hand with their European colleagues to combat COVID-19, an international family of health workers are bravely saving the lives of patients across Europe.